enter the room.
Hello.
Hi, doctor.
Hello, I'm Dr. Farisha, one of the doctor in the neurosurgery department. Is this Drac Martin?
Yes, I'm Drake.
Okay, could you please confirm your mother's name and age?
She's Angela Martin and she's 80.
All right. I'm here to talk about your mother's condition.
Yes, I
So,
have been waiting for you. How is she doing, doctor?
all right, I'll be explaining everything about her condition to you shortly. Before that, let me ask you a few questions in order to assess the situation better. How much you know about your mother's condition?
Well, she had surgery and now after that I haven't really met her. I'm actually hoping for somebody to tell me how that surgery went. I'm waiting for that.
All right, I can see that you're very much concerned about your mother. I'm here to discuss about that. Do you know what surgery has been done for her?
There was this brain surgery that was done. She had some, mass, they said, in her brain. So they said they needed to operate that.
All right, thank you for that. Let me ask you some of your mother's medical history. Is she diagnosed with any medical conditions in the past?
Oh, no, doctor. She was absolutely fine. She didn't have anything.
All right. As you said that your mother had a brain surgery.
Mhm.
Actually, there was a mass in your mother's brain, and the operation was to remove the mass from her brain.
Yes, that's correct.
Uh, yeah. And we did the operation, and the operation was a success, and we shifted her to the recovery room.
Okay.
And after that, unfortunately, we noticed that one of her body part was not moving.
Hmm.
And we did a CT scan to check for that. Did
Okay.
anyone of you discuss about the result of the CT?
I didn't know that there was a CT scan done. I'm not, I don't know about this. Okay. No, nobody discussed anything.
I'm really sorry for that. We did a CT scan of her brain. Uh, Unfortunately, I don't have a very good news for you.
What do you mean, doctor? What happened?
May I know, do you want anyone else to be with you while I disclose this to you?
Uh, I'm not sure. What are you trying to say? Is she fine? Is she still alive?
All right. Yeah, I'll be discussing that with you. Uh, we did a CT scan of her brain, and it shows that there is a stroke in her brain. She developed a ischemic stroke after the surgery in her brain.
I'm not understanding. What are you trying to say? What is this ischemia? What are you saying?
All right. I'll explain to that to you. After the surgery was a brain surgery, and after she was taken to the recovery room, when she developed this weakness, we check for the CT scan. That is the imaging test we do in the brain, and it shows that there is a stroke in her brain. That means some of the vessels in her brain is not working, is not pumping blood properly. Do you get me?
Why? What happened? Is that what happened after surgery? Is that what happened during surgery? Did you people do something to her?
I'm really sorry that you are thinking that way. The surgery was a success, but unfortunately, this
But
is one of the complication of the surgery.
how are you calling it a success if such a thing has happened?
Unfortunately, this is one of the complication of the surgery, and I'm sure that one of my colleague must have discussed about all the possible complications to your mother before the surgery.
I don't know about that. I mean, you're talking about a lady who's been having personality changes and who wasn't coherent most of the time. How is she supposed to understand this is a complication? I didn't know this was a complication. What are you trying to say, doctor? Is
Actually,
she alive? Can I meet her?
I can see that you're very much upset. It is understandable that you're going through this. She is in the intensive care unit right now, and she's waiting to be reviewed by the stroke specialist. Only that we can say what else can we do for her.
Can I meet her, doctor?
All right, I will talk to my seniors, and I'll let you know that you can meet her as soon as possible.
Will she get better? What will happen? Will she be able to move her body parts?
I can see that you're very much worried about her. Uh, she's in good hands, and a team of expert doctors are looking after her, and we are doing all our best to make her recover as soon as possible.
2 minutes remaining.
That's not saying anything. You think she'll recover? Is she going to?
Unfortunately, I'm not in a better position to answer that. She's still in the intensive care unit, and her condition is critical. She has to be reviewed by the stroke specialist, and according to that, we can see what can be done for her. And we are hoping for the best, and we are doing all that we can do for her.
I don't know, doctor. I don't know what to think right now.
I can see that you're very much upset. May I ask you, do you have anyone else with you to support you?
As of now, I don't really know. I don't have anybody around. I have a sister who I can call, but I don't know how to talk to her.
That's all right. We can help you with that. Should we call your sister to be with you in this situation? Because I think you need support right now.
Yeah, that's all right. I'll do that later.
All
I
right.
come to terms with what has happened so far.
All right. All right. Do you have any other concerns regarding your mother?
I would like to talk to the neurologist who's done her surgery. I want to know what happened.
Of course, we will let you know. I'll be talking to my seniors about this, and I'll be making an appointment for you to talk to the neurologist about this. Is that okay?
Yes, definitely. Yes, that would be very helpful.
Yeah, sure. Is there any other way I can help you with?
Yeah, I don't know. I don't think so.
I can see that you're very much upset. Do you have anyone else with you to accompany you?
Not right now, doctor. I told you I have a sister. I'll talk to her later.
All right, all
Move
right.
on to the next station.
All right, doctor. Good job. Good job. I know this was just a conversation. Exactly. Dr. Sawan, give you a thumbs up. Good job. Thank you, Dr. Sawan. All right, guys. Yeah, so the examiner, Dr. Rohit, will be, after marking, will be joining us shortly. So a couple of things that I would like to say is, you broke the news a little too fast before understanding all the situation. At one point you went like my colleague must have definitely explained you the complication. I mean, how are you saying that with so much, what to say? How do you know that for sure? How are you certain of that fact? You don't know that.
Oh,
That is something you could
okay,
be gathered in the data gathering. Like, do you know what the surgery is? Do you know
mm-hmm.
what the complications of the surgery actually explain to you, right? Was she of
Okay,
sound mind? That is also one good thing to ask. The mother had
mm-hmm.
like what were her symptoms in order to find out that she had this lesion, right? You said that it was explained to her mother. Was the mother of sound mind when she was explained, right? You don't know all that.
Yeah,
And so if you're going to bring it in management and assume that those all were done, you might get into trouble.
okay, okay, yeah.
That's why it's
I
a
thought the consent must be taken from the mother, so that must be explained to her. I
mother
thought like that.
mind. You don't know that she has a brain
Yeah,
lesion.
yeah.
No,
Oh,
when
yeah.
it was right. So
Yeah, yeah, that's right.
So that's another thing, right? So definitely when you are considering these, especially to ask, it's a good thing to actually find out beforehand, by
Okay.
that kind of data gathering. You went on to ask about a medical condition, any past medical condition, that is good. And
Okay.
medication history also would have been great, just in case if she's taking any medication, any herbal supplements or anything, just in case if you, uh,
Mm-hmm.
right? And
Okay.
surgery was a success. That is again a very murky water to go in. Like, are you
Oh,
sure this is a success that you wanna, tell them? So you could say that during the surgery, we were able to take out the tumor. Unfortunately, we have encountered, unpredictable complication.
okay.
This, right? Now, if you're going to say,
Okay.
what you want to say is you've taken out the tumor, but you can't really call it a complete success.
Okay. Fine. Okay. Yeah.
And second, another thing, invitation comes before the breaking of bad news. You started breaking the bad news and you gave invitation. So I was already kind of disturbed by the time the conversation was moving forward, right?
Oh, oh,
So
oh.
yes, so we
Can
have,
you explain that?
yes, we'll go through how to break this news.
Yeah. Yeah.
The examiner with me, Dr. Rohit, he's going to be explaining you the checklist.
Oh. Okay.
Hi, Dr. Varisha. Hi, this is Dr. Rohit.
Hi. Hi.
So yeah, as Dr. Ann mentioned, yeah, you've covered actually most of the things. If you see the score, also, it's a it's an easy pass, but there are a few things that are very critical because this is marked objectively, but in the
Mm-hmm.
exam it's very subjective. So if the examiner did not like the way you did your consultation, they'll reduce your marks. So there
Okay.
are a few things that are very important to maintain in a breaking bad news scenario, especially the one that Dr. Ann mentioned, which is the invitation part. We'll just take you through the spikes protocol, how it needs to be done.
Okay.
And another thing is don't say things like surgery was a success, and our colleague must have mentioned this. So these are the things that you're assuming, right? Never assume things. Never assume things that you don't have the information on. So if you look at the candidate information in this, so if you look at the candidate information, it just says who had brain operation for space occupying lesion. That's all it says. It does not say anything about whether they took out the tumor or whether the surgery was actually successful or not. So never mention things that actually are not there in the doctor's instructions. That's very important. So
Okay.
always try to keep base your so your level of information that you have is only the candidate info that is provided to you and any findings they provide in the station. Otherwise, there's nothing else that you know. Everything you have to say, I'll find out and I'll let you know. All right.
Okay.
So this is a, little sensitive case where especially it's even more important to make sure that you don't assume things, especially things like these. All right. So
Okay.
start with the. I'll just take you through how this consultation needs to be done, and then we'll look at your points. All right.
Okay.
So this is a breaking bad news that you understood immediately, right? So what the main theme of most of the breaking bad news cases is the fact that the patient is going to have a bad prognosis, right? So that it's almost going to be certain that the patient is going to die in most of the cases. So that's the whole point of the breaking bad news scenario where you need to deliver that particular news to them. So if you
Mm.
notice so if you look at the question, shows ischemic stroke. She is now at the intensive care unit. So that's all we have information. That's all is there. So
Mm.
always keep that in mind. So whenever if they ask for prognosis, never say yeah she's going to be fine because you don't know that. There's nothing mentioned there. So just keep. I mean, you did that well. You said that it's difficult to say at this point. That's very good. Yeah, just make sure that you do that for other cases as well. Where
Mm.
never give false hope. Okay, never give false
Okay.
hope. He's going to be fine. So let's just go through the steps one by one. So spikes protocol. So spikes protocol is something that has to be maintained always for any breaking bad news. This is something that is done even by consultants in NHS as well. This is not just for the exam. Spikes is a recognized protocol that is taught in medical schools in the UK as well. All right, so don't feel like you don't think you might look scripted if you follow it. There's nothing wrong in following Spikes protocol because it is a protocol. All right. So first, setting. Setting doesn't necessarily mean that you need to be in a safe environment. You need to be in a calm environment where you won't get disturbed or anything like that. You all even in a consultation, even in the exam, you need to make sure that the patient is in a right state of mind to actually to be able to talk to you. All right. So first, in this setting basically means you need to introduce yourself and you need to tell about your role. You need to tell why you're coming and talking to her. All right. So always start with that first instead of initially you when you confirmed identity and immediately after confirming identity you went into asking the patient how why was your mother admitted, do you know anything about what do you already know about your mother's condition. Before that, first try to explain your role. So what you're going to do today. So always tell, so I'm Dr. So and so, I'm here to talk to you about your mother's condition. That's very important. So when you give your, when you mention your role, you are showing the examiner also that you actually read the question and you know what the task is, right? And then after that, you need to continue with the perception. So perception is you did that really well. You asked about what what she knows about her mother's condition, and you asked about past medical history, but you missed out medications. Make sure you ask about medication history because here it might be important because there might be a it's not like it's not going to change your management currently, but it's going to change the way you're going to explain the diagnosis to her, what happened to her, right? So if suppose there is a medication that could have caused this, for example, he's already on blood thinners, she was already on blood thinners, then you can use that in your management, right? So
Yeah,
it's
yeah.
possible that because of the blood thinners, there is a high likelihood of being a bleed. That could have been the cause, right? So sorry, in this it's ischemic stroke, right? So you can, if you can find any reason that in the history that you can use in your management, it will be helpful. So make sure you always ask about past history along with medication history also. Right? Next,
Okay.
invitation. So how invitation works is, invitation is not just the fact that you need you're asking them whether they have anybody else, whether they would like anybody else to be with them. Invitation actually means that you are preparing them for a bad news, right? So preparing from them for a bad news means the fact that you mentioned I don't have a good news for you today, that itself is an invitation technically, right?
Yeah.
Once you did that, you already told her that there's going to be bad news. So then after that, there's no point asking again, would you like anyone else to be with you? So that's just going to waste your time. I mean, in real life, it's okay, you can do all that. But here, there's no point in doing that. You've already given her an idea that, okay, there's going to be a bad news coming. So
Okay.
instead of that, instead of saying that, if you had said, how would you like anyone to be here with you, that itself is a way of telling her that, okay, there is a bad news coming, right? So the patient will definitely the relative will definitely have a doubt that, okay, there's probably something wrong, right? So that's also an invitation. So you can either use that or you can directly say that, okay, I'm so sorry to tell you, but I have a bad news for you. I don't have good news for you, right? So that is also,
Okay.
you pick either one. So after that, so in once you have the invitation, once the patient says they're ready to hear the news, then you do your knowledge. So knowledge, basically, you did that really well as well. You said that your mother had brain surgery. Say that, okay, your mother had brain surgery. So after the surgery, we found that she had found to have weakness on one side of the body. Give a pause, and then say that we performed a brain scan, and unfortunately, the results show some bad news. So here again, you can you're slowly building up to the actual bad news, and now you say scan showed that she has had a stroke, which means part of her brain didn't get enough blood for a while, and that can cause problems with movement, like we are saying now. All right.
Mhm.
Now, to stop at this point. So these rest of these explanations should come once the patient, shows the emotions and you deal with the emotions, and then you go into the further explanation. All right, because you can't talk so much before you allow them to express their emotions. Always try to, um, always try to get to the point. This is your final news that you're giving, that she's and that has caused her to have weakness on one side of the body, one part of the body. So once that is done, you kind of need to let her show her emotion and then validate the emotion. So emotions, there's something called Eve protocol. Eve protocol is EVE. So E is identify the emotion. So what is the emotion that is being shown? You identify and you say it out loud. So that's very important. So in the exam, the only way the examiner knows whether you identified the emotion is by you saying it out, right? Like for example, if the patient is angry, you say, I can see that you're upset. If you see the patient is in shock, I can see that this must be a shock for you. This news must be a shock for you. I can see that you're upset. I can see that you're angry. Always mention what the emotion you see from the simulator. Just say it out loud, right? So then that is E, that is emotion, identifying the emotion. And then V is validating the emotion. So validating emotion means you just need to tell them that what they're feeling is valid. Means like it's not that they just need to say that I can totally understand why you would feel that way if it's an angry patient. Here I can totally understand it must be a shock for you. I can only imagine what you must be going through. I can only imagine, how difficult this news must be for you, right? Then, last is empathy. Empathize. So you need to say that I'm so sorry for that, and I'm here to do as whatever I can to help you. Right? That is, you need to show all three in this E part, and then again, now she's going to ask you questions. So then you explain the things. So this is a possible complication of the surgery, and don't say that it was explained to you. If you wanted to do that, you should have done that in your data gathering itself, right? When you are asking for perception itself, you could have asked, so before they went in for surgery, was anything explained to you? Were the possible complications explained to you? Right? If you wanted to bring up the fact that it was explained to them, you should have done it back then. So now there's no point. Now it seems like you're just avoiding blame, right? It sounds very bad because we're just trying to say that, okay, it was explained to you, so it's not our fault. It sounds like that. So never do that when after you've actually broken the news. All right. So instead of
Yes,
that,
sir.
you say that it is a possible complication of the surgery, and it doesn't matter whether it was explained to her or not at this.
Right.
And then you need to explain why this could have happened. There is reduced blood supply to the brain. That's why it is. So ischemia. So when you said ischemia, you need to tell what that means. You can't drop a difficult medical term and not follow up with an explanation. You always have to follow up with an explanation in layman terms. All right. So you said we did a CT scan and showed ischemia in a part of the brain, meaning that there was not enough blood supply to the brain, to that part of the brain for a prolonged duration, which caused that part of the brain to get damaged. Right? That's how you
Okay.
explain the ischemia part. And then you need to explain the fact that she is in a serious condition. She is in ICU, right? She is in ICU, meaning that she is definitely in a serious condition right now. So you need to explain that fact as well. It's not just that she has weakness in the part of the body. She's not woken up yet. You need to explain that to her, saying that, okay, so she is in ICU right now. She is going to be looked at by the specialist, who will be able to give you further information, right? So now,
Okay.
you mentioned ICU. You also need to mention what is going to happen in the ICU. Right? That's also important. So why is she in the ICU? You need to mention that because she requires close monitoring and support. That's why she's in the ICU currently, and that's why she was shifted to the ICU. So all these will come in the strategy and summary. So now, if you want, you can take further history here. So now, once that part is done, now you need to ask. You ask that whether she has anyone to support her. That's good. Always make sure you do that, because you don't know if the patient, if there's anybody else to support. She might be the patient, the relative might be the only one. The mother might be the only one taking care of them, and always make sure that you ask if they have enough support, and ask how can we support you, right? And you can also tell them that we will be nearby. If you need anything, you can always come and ask us, and we will somebody will be able to help you at all times, right? You can say that. And now you need to how do you safety net in this patient, in this case? So there is, so the patient is not with the relative, so there's not much you need to talk about safety netting for the patient per se. Instead, you safety net in terms of the relatives, perspective. So what would they be feeling? Like, how could you support them? So if you feel like, it's overwhelming for you, and if you feel like you want somebody to talk to, please let me know. I will arrange that for you. You can't just, because you don't know what's going to happen. They might be in an emotional state there where they might harm themselves, right? So always leave that safety netting for them, saying if you need anybody, anyone to, will always be available for you. Please come and ask us. Right? That's a safety netting here. And leaflets and pamphlets you can provide here as well. Right? You just given a diagnosis to her, we can explain. She can read more about it there. So you can say it in a way that I am so sorry. This might be too much, to go through right now. But I'll provide you some, written material that we can actually read about. Which will explain the condition more, and explain the management more. All right. So always never forget a safety net, leaflets and pamphlets and follow up. Whatever case it is, you can always somehow bring it up, right?
Okay.
So I'll just take you through the checklist. Okay. So if you look at the points that you got to tick on, so consultation. The consultation was so consultation is usually get a tick there if you consultation was disorganized. So what is disorganized consultation? So you always need to have a structure. So for example, here it's Spikes protocol. So in Spikes protocol, if you manage to maintain the Spikes protocol exactly, as it was supposed to be, you wouldn't get a tick there. So you did really well, but just a few things that were mentioned, which is the invitation, should come before you actually break the bad news, before you mention that there is a bad news, right? That is a very important part. That is one thing. And findings. So findings basically means that there were some data gathering that points that you missed, which could have been useful for your management. So that's how you would get this tick in your findings. So which is basically you didn't ask for medications. That's the main reason that I've given you tick here. But otherwise, it was pretty good. Your data gathering was to the point where what are the things that you were needed. And another thing was you could have asked about whether she was explained about the complications. So instead of bringing that directly in your management, you should have asked that in data gathering, right? And language. So language you usually get a tick if you use medical jargon. So here ischemia, when you mentioned that kind of before the patient gives a reaction, you should actually have a explanation for it. So before the patient asks you what is ischemia, I don't know, you should immediately follow up. Whenever you mention any medical term, always immediately follow up with a layman explanation, right? That's very important. Then listening. So listening, because he kept asking at the end, you asked at least 3 times, I think, if you have anyone else to be, if there's anyone else with you. So that kind of threw the patient saying, I already told you I don't have anyone. My sister is there. I'll call her. So make sure that you don't repeat the questions. Then you would usually get this tick in listening, right? Otherwise, it's fine. It's not that big of an issue. But yeah, make sure you don't repeat questions. It's very important not to repeat questions that have already been asked. And your management. So management, the few things that you missed. So I'll just show you the points that you. So okay, data gathering. The points that you missed are medications, patient's social background, living arrangements. If the patient was living independently, or if the son was living with her or not, you could have asked that. And concerns and expectations regarding the mother's recovery. Uh, this is okay. I mean, you kind of brought it up in the beginning itself. That's good. Then in your management points that you missed are so potential complications of brain surgery leading to stroke. I gave you partial because yeah, like I said, you should have asked that in your data gathering. Instead, don't say that. Don't assume things that is already explained to them. That's important. And mechanism should be explained simply. So you never mentioned that what ischemia is, like reduced blood flow leading to damage to the brain. That part needs to be explained. That was never explained. That's very important. And so these three are partial because ICU admission you mentioned, but what is going to happen in the ICU is not mentioned. All right, so there's a lot of management to be done in this case. So breaking bad news cases are mostly management. So even the way you deliver the news is also management. So always think about what other points need to be included after you've actually delivered the news, right? Then outline the next steps. Stroke specialist you mentioned, but you don't know what, you didn't tell what the stroke specialist will be doing, right? So you need to explain that they're going to assess the extent of the damage and they're going to see what is the potential for recovery, right? So these two are things they need to mention. Then written information is very important. Never miss leaflets and pamphlets. There's always one mark for it, no matter what station it is. And visiting arrangements, that was good. You answered that correctly when she asked, when can I see my mother? And follow up and support. So this is also important. You need to know what is going to happen. You need to tell them that okay, I'll come back and talk to you again in some time. If not, you call somebody, then they'll be able to ring me up. And that's also, you need to give them a information where they know that this is not the last conversation you're going to have with them. Right? That's very important in these cases. Otherwise, your interpersonal skills are really good. So one thing is explaining your role in the team. That's very important in all the stations. Always try to explain what you're going to do, what your role is. Yeah, I think that's all from my end. I'll just pass it on to Dr. Anne.
Thank you so much for the clear explanation.
Thank you, Dr. Rohit. That was some expert explanation from his side, but I changed a couple of things in the case itself because there was a line about the surgery was a success. So you can either find out like how much they know. So in this case specifically, I did not offer up this information as a simulator, but sometimes when you ask in this case how much was explained to you, they may actually tell you that, yeah, I was told that the tumor has been removed, right? So you know that the patient or the relative knows till that point, and then in recovery, she started losing, the power of movement of one side of her body. So from there, you need to start filling in the information, filling in the patient about what has happened, right? So one way I have actually written that is like this. Oh, I'm so sorry, I'm not sharing my screen. I'll just quickly share my screen, guys. Right. So the operation was successful in taking out the tumor. So if that is something that you know that the relative knows, you can actually offer that information. However, after the surgery, she was found to have weakness on one side of the body in the recovery room. So while breaking the news, you're trying to layer it from, what they know, what they don't know. So as you know, your mother had brain surgery. The operation was successful in taking out the tumor. However, this is where you're actually starting to fill in on on the facts that they don't know yet, and you're supposed to break it to them. She was found to have weakness on one side of her body, and because of which we performed a brain scan, and unfortunately results include some bad news. And then explain the news before you actually pause for the emotion, because that is the main thing that they are going to react on, the fact that she had a stroke. So make sure you end that entire knowledge section with the last bit of information, which is the most heaviest to take, right? And then pause for the emotions. All right. So I hope this was useful, because in the candidate information, that's what you might actually see, that, she is in the recovery room with, uh, you know, she's in the recovery room, and it was noticed that she was unable to move the part of her body. Right. So this happened in the recovery room, but you don't have any information on how the surgery had gone. So maybe it might be there in the candidate information, or else you can actually ask the patient of, what you know so far, what was told to you. If that was something that was told to them, that way you can actually bring that in your management. So you would also be able to fill in the timeline of, the events that has happened. So the timeline can actually be from the information that has already been given to you, and the rest of whatever you don't know, you need to ask the patient, right? So that, you are clear on what has happened so far. All right. So I hope that was helpful. All right, so there was a correction that we made, and that is thanks to Dr. Saman due to her critical thinking on the case of mesothelioma. We did that matter, and it was made clear to us that it was still a suspected case of mesothelioma. At no point was it confirmed. So unless it's confirmed, you can't break it as a bad news. So you would actually send them for the cancer referral pathway, suspected cancer referral. So since this is a suspected case, and at a GP surgery just with an X-ray, you will not be able to diagnose it as mesothelioma, even though you have very strong correlations. It's better to take it to, or leave it to the specialist to do that, unless you have a confirmation with a specialist diagnosis or a specialist test that has been done. So thank you so much, Dr. Saman. We have made the necessary changes. And there were a couple of other questions that did come up yesterday on whether anabolic steroids, having testosterones, can they actually cause stroke? We did a couple of research, and we did find some evidence around it, and we made a blog. Another question was from Dr. Mishi about whether tranexamic acid can be given during the ABCD protocol. So that is also something that we have seen, that early administration of tranexamic acid is actually improved. So, but what do we do if the patient is unstable? So the main thing to actually understand over here is that you need to first resuscitate the patient. All right. If the airway is blocked, if the circulation is not happening, the medication delivery is almost, at this point, it has no purpose. So only after making sure that the airway breathing circulation are all right, you can actually go ahead and do that. But unfortunately, there is very little evidence when it comes to GI bleed. So this is usually seen in trauma cases. So most of the trauma cases is where the tranexamic acid is given. So we would advise you against using, the tranexamic acid for the GI bleed. So I just wanted to put it out there. And we have also made some other blogs.
Thank you.
Absolutely, Dr. Mishi. Don't worry. Actually, we appreciate this critical thinking. Anything that you have a doubt, don't take it blindly. you know, question everything, understand why you would be saying a certain thing. You know, nobody is kind of telling you to read a script out. You know, that's not the exam. The exam is using your clinical judgment. And do question everything. We really appreciate it. That way, you're also making us, you know, better in doing so. So, thank you everybody for that.